Welcome to DermTV Viewer Questions Week for March 2014. Today's episode will feature questions from DermTV YouTube viewers as well as DermTV.com viewers. Hello, I'm Dr. Neil Schultz, and welcome to DermTV. Today's first questions are from DermTV YouTube viewers. Anna asks, concerning the episode on what products can you use with glycolics, can I use a toner with glycolic acid and a glycolic acid treatment of 10%? Anna, really you should only be using one glycolic product that's strong enough to do what you want your glycolic to do in terms of exfoliation or in terms of acne prevention. You really shouldn't need to use two different products. Having said that, if you like your 10% glycolic product, and you'd like to use a glycolic toner in addition, like any other new product, why don't you try testing the glycolic toner in a small area in front of your ear for 2 or 3 days, in addition to using the 10% glycolic toner. And if there's no irritation, then by all means, you can use that product. But the bottom line is your single star main glycolic product should be strong enough to do everything you want it to do, and you shouldn't need to use a second one. Vin Daniels asks about the same episode, what products can you use with glycolics? I don't get why you should not be using salicylic acid exfoliants on your whole face. Research shows that they can be very beneficial at a strength of 1 to 2% because they not only exfoliate the surface of the skin, but can penetrate the pores because they are oil soluble. That's all true. Also, they have some anti-inflammatory and antimicrobial effects, and that's great for acne. So I want to know what's wrong with using it on your whole face. Vin Daniels, everything you've said is correct. My point was that salicylic acid at 1 or 2% is very valuable as a spot treatment for acne. But it doesn't have the exfoliating powers that glycolic does if you want to use a full face glycolic for exfoliation. So the research shows exactly what you said, but the research also shows that the glycolic acid is a more effective exfoliant for your whole skin and is much better at generating collagen and helping with processes in the dermis. So there's nothing wrong with using a salicylic acid toner on your whole face or product on your whole face if, in fact, you like what it does and it's helping keep your acne in check. But my only point was that if you want total facial exfoliation for younger looking, healthier looking skin, or for acne control, I think glycolic is better for the whole face, and salicylic acid then as an adjuvant treatment would be used at 1 or 2%, as you've mentioned, as a spot treatment. Aquamini, again about what products can you use with glycolics. What about tea tree oil cleansers and toners? I love tea tree oil. I even have tea tree oil in many of my products, and there is absolutely no problem with using tea tree oil containing products with glycolic, and I strongly encourage you to. Amira asks about the episode, Why Smooth Skin Looks Younger. I want to know if steaming your face with hot water is bad for you. It's only bad for you if the steam is too hot and it's actually touching your skin, because if it touches your skin and it's too hot, it's going to irritate it, which is a natural segue into the second part of your question, does it result in broken capillaries? Not if it's not too hot and not if it's not touching your face. If it is touching your face and so hot that it's actually causing your skin to get red and the skin stays red for 15 or 30 seconds, then it could be capable of causing broken capillaries, and that's not for you. And you've got to back off a little bit. These questions are from DermTV.com viewers. Crystal asks, I'm thinking of seeing a dermatologist, but is it really necessary? I break out maybe once or twice every 3 weeks to a month. My acne always hurts though. It hurts to the touch. Should I just use some other products or something? How much does it cost to see a dermatologist? Crystal, if you're getting painful outbreaks every 3 to 4 weeks, I think then, and they're not responding obviously to the topical products you're using, then it would be beneficial to see a dermatologist to get medicines that would help prevent these breakouts, particularly since they're painful. In terms of how much does it cost, it really depends where you live. It could be $75, $150, or $250, depending on the community that you live in. But certainly, for painful, regular, recurring lesions, which sounds like they're cyclical probably with your menstrual cycle, I think it's time to get some help on the inside to help prevent them. Mrs. Fassbender says, "Hi, Dr. Schultz. I'm 40 and I've been using a 14% glycolic serum day and night along with zinc sunscreen every day for a few months now as I suffer from melasma patches, dull skin, and fine lines and wrinkles. It has improved my skin and leaves me with a healthy glow." I am very happy to hear that. As I'm now 40, I was thinking of switching to tretinoin, which is the actual generic name for Retin-A, as I'd like to stimulate my collagen and elastin production along with addressing my fine lines and wrinkles. I was told that glycolic was the, quote, baby step, unquote, system and should be used when you're in your 20s and 30s, but when you're in your 40s, you need to switch to tretinoin, as tretinoin is superior to glycolic at stimulating collagen and elastin and softening fine lines and wrinkles. Could you help me? I think that's a great question. I've actually never heard of glycolic referred to as the baby exfoliant or the starting place, and I believe that amongst chemical exfoliants, glycolic is the gold standard, and I recommend it for people of all ages. It is true that tretinoin does help with collagen, not with elastin, but with collagen formation, but so does glycolic. And actually the research on both has shown that they both do approximately the same thing in, number one, making collagen, number two, glycoaminoglycans, which is that semi-liquid matrix in the dermis, both of which help add volume to your skin, as well as in helping to relieve or reduce fine lines and wrinkles, not medium lines and wrinkles. Neither of these products, by the way, really make functional elastic tissue. They can make elastic tissue that you can see under the microscope, but that elastic tissue doesn't really work. So as far as I'm concerned, they are roughly equivalent at what they can do when you're in your 40s and 50s, but for many reasons that you've seen covered in other DermTV episodes, I think that glycolic is the gold standard. It's less irritating, it's not irritating, it is not photosensitizing, and I find tretinoin to be very brittle, meaning the margin between efficacy and irritation is very small. There isn't a week that goes by that I don't get questions about retinoid irritation, including tretinoin, from DermTV viewers. So as far as I'm concerned, I'm passionate about glycolic, and I recommend glycolic over Retin-A or tretinoin whenever possible. Today's last question comes from Jane, and Jane says, "I'm curious if antioxidant supplements like heliocare and vitamin C serums can work to repair accumulated sun damage over one's lifetime, or are they only effective in repairing and preventing sun damage that the skin may have been exposed to over the last few days?" Jane, you are correct in saying they are only effective in preventing sun damage. They do nothing or not much to repair sun damage, with one exception. So really we're talking about preventing sun damage. This is a forward-going process. You use antioxidants to help prevent future damage, just like sunscreen. It's not really for repairing old damage. And the issue is it's a preventative. And it doesn't prevent stuff that happened 2 days ago. It's only going to prevent stuff that happens when the antioxidant is on board, because the antioxidant on your skin helps to protect the cells from free radical damage that occurs as a result of dangerous UV radiation getting past your sunscreen and therefore causing damage inside the cell. But when the antioxidant is there, it prevents that damage. The one exception where a vitamin C-based antioxidant can help repair old sun damage is that vitamin C can help prevent and reduce melanin pigment formation, which comes from ultraviolet damage. So in that respect, an effective vitamin C-based antioxidant can help to repair some of the pigmentary damage caused by previous sun exposure. So that's it for this month's Viewer Questions Week. And don't forget, the subjects from so many DermTV episodes come from your questions, which are great. So please keep sending them in, and I'll keep answering as many of them as I can. Please join me again at dermtv.com. If you have a question, please send it to me by visiting dermtv.com/question. I'm Dr. Neil Schultz, and thank you for watching today.